Every symptom of spinal degeneration explained. Your spine is already breaking down. Not someday, right now. And the scariest part, you probably feel fine. 85% of people over 50 have visible spinal degeneration on imaging and don't know it. Because the symptoms rarely start in your back. They start in your fingers, your head, your bladder, your balance. Here are all 8 symptoms, and 2 of them are medical emergencies. Symptom 1, chronic back and neck pain. Most people blame stress or bad posture. The real cause is often chemical. When a disc degenerates, it doesn't just flatten. It releases inflammatory proteins called cytokines directly into surrounding tissue. These chemicals fire up nerve endings even when nothing is visibly compressed on an MRI. That's why your scan looks mild and your pain is severe. They are not the same thing. By age 60, cervical spondylosis, degeneration in the neck, is visible on X-ray in 85% of men and 70% of women. The pain sits at the base of the skull, across the shoulders, between the blades. Dull, constant, always blamed on something else. Symptom 2, numbness and tingling. Your spine has a map. Every nerve root controls a specific region of the body. When a disc compresses that root, you feel it downstream, not at the spine. L5 compression, numbness on the top of the foot. S1 compression, shooting pain down the back of the leg into the heel. That's sciatica. C6 in the neck, tingling in the thumb and index finger. C7, the middle finger. If you regularly feel tingling in specific fingers after sitting at a desk, your cervical disc is already talking to you. Most people ignore it for years. Symptom 3, morning stiffness and loss of flexibility. Taking 20 minutes to stand up straight is not aging. It is a failing disc. Healthy discs rehydrate overnight like sponges, regaining height while you sleep. Degenerated discs lose that ability. They start every morning at their flattest, driest, most damaged state. Movement warms the surrounding tissue and provides temporary relief, but the disc itself does not recover. Over time, the body responds by growing bone spurs along the vertebral edges. 90% of people over 60 with spinal degeneration have them. They can permanently reduce spinal range of motion by up to 40%. No stretch removes a bone spur. Symptom 4, muscle weakness. This is not a muscle problem. It is a signal problem. Motor nerves carry electrical commands from your brain to your muscles through the spinal cord. When a degenerated disc compresses the nerve root feeding a muscle group, that command is interrupted. The muscle is there. The brain is sending the signal. It just isn't arriving. L5 compression causes foot drop. The foot cannot lift during walking, and falls become a real danger. C7 compression in the neck weakens grip and triceps. These deficits often begin as subtle losses, a jar lid that's harder to open, a hand that feels slightly off, and get dismissed for months before anyone investigates the spine. Nerve compression beyond 50% of the canal diameter can cause permanent muscle damage within 6 to 12 weeks. The window to reverse it is short. Symptom 5, headaches. If you have chronic headaches that don't respond to medication, your neck may be the cause, not your head. The C1, C2, and C3 nerve roots share a pathway with the trigeminal nerve, the main sensory nerve of the face. When those cervical joints degenerate and inflame, pain travels through that shared pathway and arrives at the forehead, temple, or eye. The brain reads it as a headache. The origin is in the spine. In a 2019 study, 78% of chronic cervicogenic headache patients showed C2, C3 facet degeneration on imaging. Most had been misdiagnosed for years. Every inch your head sits forward of neutral adds 10 pounds of load to the cervical spine. At 3 inches forward, a typical phone posture, that's 42 pounds instead of 12, every day. Symptom 6, balance and coordination problems. Getting clumsier is not a normal part of aging. In many cases, it is your spinal cord being compressed. Cervical myelopathy occurs when degeneration narrows the spinal canal enough to squeeze the cord itself, not just a nerve root. The cord carries both movement signals going down and position signals going up. When both are disrupted, you get a specific cluster of symptoms: shaky hands, wide, unsteady walking, electric shocks down the spine when you bend your neck forward, and overactive reflexes in the legs. This is the most commonly missed diagnosis in adults over 55. The spinal cord has almost no pain receptors, so many people lose coordination and strength for years with no neck pain at all. Without surgery, 60% of untreated patients deteriorate significantly within 6 years. Symptom 7. Bowel and bladder changes. This is the symptom people are most embarrassed to mention. It is also the one that cannot wait even one day. When a large disc herniation compresses the cauda equina, the nerve bundle at the base of the spine, it disrupts the nerves controlling the bladder, bowel, and sexual function. Urinary retention, sudden incontinence, or saddle anesthesia, numbness in the inner thighs and groin are the warning signs. A 2020 meta-analysis of over 3,500 patients showed that surgical decompression within 24 hours produced full recovery in 61% of cases. Beyond 48 hours, that dropped to 29%. There is no symptom in spinal degeneration where timing matters more. Symptom 8. The emergency red flags. Everything above belongs on a doctor's list. These belong in an emergency room. Tonight. 1. Sudden inability to urinate or loss of bladder control. 2. Loss of bowel control. 3. Numbness in the inner thighs, groin, or perineum. 4. Rapid weakness spreading through both legs within hours. 5. Severe spinal pain immediately after a fall or impact. 6. Spinal pain with fever, night sweats, or unexplained weight loss. 7. Pain that does not change with any position, especially at night. One of these is enough. You do not need all 7. You do not wait and see. Now you know what most people spend years learning the hard way. Chronic pain is chemical. Numbness follows a map. Morning stiffness is a disc failing to rehydrate. Weakness is a blocked signal. Headaches can start in your neck. Coordination loss can mean cord compression. And bladder changes are never just embarrassing. They are a clock that is already running. If you recognize multiple symptoms, book a spinal evaluation. If you recognized any of the 7 red flags, stop this video and go now.